My name is Pawan Kumar. I lead the analytics and data team at Acufore. We are the industry experts in equipment engineering and services, along with the product validation services. So within analytics, we are catering to multiple capabilities under AI and ML. We're going to walk you through some of the capabilities that we have developed within healthcare industry. So primarily, we're looking at efficiency in documentation compliance. We are looking at entity extraction. We have massive amount of data which is getting generated on a daily basis, right, from hospitals, the clinics, and the entire healthcare professionals. How are we going to infer this information and make effective utilization of this data? And finally, we have clinical insights. So we can look at what kind of actionable patterns and trends we can support, which will help us look at the data-driven clinical decisions across the board for the medical professionals. This is one of the most promising area where AI is actually contributing a lot in the drug discovery and genomics. So the amount of time it used to take to discover and get the drug out to the market, it has actually predominantly reduced drastically, and AI is contributing a lot in terms of improvising the accuracy and the overall impact it will bring to the drug discovery. Through AI and ML implementation, we have completely moved to a paradigm shift where we are looking at proactive healthcare solutions, where we are looking at preventive, monitor, and completely detecting the diseases at the early stage. Medical chatbots. Some of the professionals are relying heavily on these areas, where they're trying to get information on the drugs, the treatment plans, the guidance they can get on the symptoms. We have actually curated some of the unique solutions for the healthcare industry, which is helping broader medical professionals across the board. So to start with, the first solution that we are offering is the radiology imaging for smart hospitals. While the imaging time would remain the same, but to get the report from the radiologist, it would take about a day or two, a maximum a week. To address this one, we came up with the solution through completely AI-led imaging and decision support. The time it takes for you to generate a report would drastically reduce from 3 days or a week to under 2 minutes. So this is one of the sample report that we have generated from the platform that we are using. So similar use case is there for the pathology, where the accuracy is we are trying to focus more on accuracy and fast turnaround. We actually curated a very specific solution called healthcare knowledge base, which will help all the medical professionals in the industry, right from understanding the medical intelligence for the disease conditions, diagnosis, the treatment plans, medications, dosage or relevant dosage which should be provided to them, and side effects of those medications. So this information is very handy for every healthcare professional at their fingertips, instead of relying on publicly available sources where it is not authenticated or validated. But however, this information that we have created is going to be a reliable source, and it is going to be a single source of truth for the entire healthcare professionals. So we can take this complete package solution for the hospitals or clinics or diagnostic centers. Or in case you want to look at individual solutions, we can also do the customization and do the integration for your respective applications that you are currently using. One of the pain areas that we have observed across the hospital, there's from the patient standpoint, and even from the hospital administration standpoint, is how do we process the insurance claims? Instead of waiting for 4 hours or 6 hours timeline, which was a traditional approach, this can be done immediately within a span of 5 to 10 minutes. So the entire value chain and the communication we have updated in the entire workflow. The agent continuously updates this information and sends the automatic alerts and keep them informed on an ongoing basis until the person is getting discharged. Typically, any hospital that you go, you will observe that in the ER room, you will find a general physician itself to handle all the emergency cases. But being a general physician, he or she will not be able to address every concern which is coming in the ER day and night. So how do we make sure we create a rescue path to an AI ML workflow? So we curated a customized workflow across the board for the rescue path, right from giving an interface for the general physician in the ER room to capture the basic information of the patient condition. This information will be passed on to the entire value chain. This is going to be a big breakthrough for majority of hospitals if they're trying to implement this one. We have seen a major improvement with the people who have already collaborated, and it has helped them to actually leverage this particular solution in a better way, because it is definitely helping to address the cases at a faster pace. Any patient who's coming in both OPD or inpatient consultation, after the discharge or even after consultation, they need a lot of information to process. Do they have enough information for them to actually continue their treatment plan, or they need to have someone who can guide them even after the discharge, even after the consultation? That's the core problem statement that we are trying to address here by coming up with the agentic AI enabled patient engagement. So all of this information will be fed into the patient medical records or the EHRE platform that we have. And for each of the use cases, we have virtual AI chat assistants for continuous information that you can ask. With regards to the same AI assistant for the doctors, it'll give you more information for the doctors or healthcare professionals. And there you can see diagnosis, the treatment plan, even the medications and different alternative approaches which were taken care earlier by different doctors. You can continuously keep track of user health information along with the medicine. If there is a follow-up appointment along with the lab test which has to be done, there's one more alert that you can send for the booking appointment for the lab test and even for the follow-up appointment for the doctor. So the entire patient engagement care you have enabled through a multiple agentic AI approach for multiple use cases, right from OPD, inpatient, even for the home care. If at all we are going through an emergency case and you want to see how many people are available right now who can take care of the emergency case, so we can have a complete visibility of that one in these dashboards, and data-driven decisions can be taken care of. So overall, these are the solutions are AI-enabled and ML-enabled solutions that we have curated for the healthcare industries. In case you have very specific requirements, please do reach out to us. We can customize the solutions for each one of the use cases. So in terms of benefits that you look at, we already have pre-trained LLM models and the algorithms for the different use cases. So the infrastructures can be scalable, and operating costs, we kept it very lower. It is not going to be a major concern because the operation cost is going to be pretty lower compared to the other available solutions in the market. So here are the contact details from our team. In case you have any specific questions, so you can always reach out. We can if there's a need, you want to have a demo, we can do a quick demo for each of your use cases. And as I mentioned earlier, we have a complete solution on the EHR and EMR with all these capabilities. In case you are looking at only one or two capabilities that we spoke earlier, we can customize those and integrate within your existing applications as well.